Hi, this is Ramon again. It's Saturday night, February 11th, 2017. I'm not going to be here for long, so I'm going to go drink with a couple people. Um, I'm just going to do a follow-up on the Cruz versus Sanders debate. I saw a few progressives a couple days after the debate try to rehash it as if Sanders had been the winner of the debate, and it's almost unbelievable that they would. First of all, look, I'm not saying that the debate settles the argument of public option healthcare or single payer system versus free market healthcare. That's not the issue of deciding who won the debate. The issue is who made the better case. And Sanders did not make a good case for Obamacare, which is really the topic of the debate. The agenda for the debate had nothing to do with single payer or public option or Medicare for all. And Sanders, in his zeal to push those policy points, he kind of went off the deep end there. During the entire debate, he talked more about the advantages of those things than of Obamacare, which leads me to believe that Sanders sees the platform of being able to go on that debate stage in order to push his vision of healthcare, as opposed to sticking to the issue at hand, which was Obamacare, and whether the Congress and the president should repeal it. And I went on this video earlier where this guy, his name's Mike Figueredo, his podcast and I don't know if it's a podcast, but it's a video series. They're super progressive, and let me look at some of the comments that people wrote. So let me reorganize it where the progressives have failed. On one of the points, they say that Ted Cruz acknowledged what Bernie Sanders has been claiming the whole time, which is that health insurance companies are only in it to make money and that they're not there to provide health care as a right. Well, in the context of the debate, that's not what really was the point, okay? What Ted Cruz was saying was that after Obamacare, which Bernie Sanders, let me remind you, voted for, after that, the deductibles and the premiums rose substantially, okay? They rose it depends on the state, but in some states like Oklahoma, Obamacare premiums rose 95% for some plans between 2016 and 2017 for the new year. That's really the point Ted Cruz was making. What the Humanist Report, what a lot of progressives were trying to say was, well, that just proves our point that the single payer and public option are the only ways to go, that the insurance companies can't be trusted. Well, that's not. The fact is that the debate, I don't give a fuck what your vision is. We're not talking about your vision, progressives, of what healthcare should be. The debate itself was about whether the ACA should be kept or scrapped. And unfortunately, Bernie Sanders was using the platform not to argue in favor of the ACA as it was passed, as it failed to be improved during the entire Obama term, but rather in order to push the single payer system. Look, Bernie Sanders was free for the entire year of 2016, well, even prior to that, during the start of his campaign in 2015, to say, look, I don't think Obamacare is right. I think we need to replace it with a public health care system. And he did do that. And that's the first point where they make the slip. They try to say, oh, because Ted Cruz used the position that healthcare insurance companies are only in it to make money, therefore Bernie won the debate because, look, he's got an indefensible position. Another thing that Figueredo said was that that was an indefensible position, that healthcare is not a human right. Well, unfortunately, progressives, those of you that would be watching this, not that there's many, It's not written anywhere, and Bernie Sanders hasn't cited it anywhere. It's just his opinion. Now, another issue that they keep citing, look, there are a number of comments that I put a comment on here. I said, you people are literally out of your mind. Go back and watch the debate from beginning to end. Bernie did not cite anything, nothing. You have no basis to claim that he won anything, since all he was saying was the same mindless crap that got all you to jizz your pants during the election. Millionaires and billionaires, healthcare is a right. Special interests. He was completely inept at answering the small business owner's question. That was the lady from Texas, the hairdresser. And every time he kept trying to drag Cruz into supporting Medicare for all, which is true. He was always trying to get Ted Cruz, this was just political grandstanding, trying to get him. And Cruz was there to politically grandstand too, in favor of repealing the ACA. So he was on topic. It's okay to grandstand, Bernie, but you're there to defend the ACA. You still have to defend it, even if you don't agree with it. And that's another thing I'm going to get to soon. So then I ended up studying the actual, or bring up the study that Cruz actually cited from the Urban Institute, and I put the link there. I'll put a link for that up in this video too. And it's true, the Bernie Sanders plan, I believe in that article said, would in that study, it said it would cost $2.75 trillion to fund within the first year. And I'll put up the real numbers when I put the description up. So don't come back at me and ask, well, why'd you say in the video? I'll put up the real numbers. I'm not gonna leave you hanging. So I got a few comments. The first two actually said, yeah, he didn't really win the debate. And actually Mike Figueredo, the Humanist Report moderator, a guy who I actually cussed out once and he got real pissed at me. Mike Figueredo actually said, well, he thought that Sanders would clean Cruz's clock, which isn't what happened. And the reason is that Bernie Sanders isn't a good debater. Okay, that's what Democrats and progressives have to realize, that Bernie Sanders, you might like him, and he might be a sympathetic figure, and he might be very nice, and he might be he's a good mensch, as they say in Yiddish. That doesn't make a good debater. A good debater is somebody who can actually address the issue, which he didn't. And then somebody said, 3 people turned away at the hospital versus millions of people who can't afford health care, period. Yep, Ted totally won. Well, they still can't afford health care, by the way. This user, he just put FAE. FAE, look, they still can't afford health care under the ACA. That's what the topic was about. Okay? So, I don't know, well, how did Bernie win then? Because can they afford health care now? Health care has gone up. And the ACA was coincident with that. And those who say that the healthcare costs would have gone up anyway, then why did you need to institute all of that infrastructure, all of the healthcare exchanges on the state level that have failed? Why did you have to waste all that money just to get the same rise in healthcare costs, to get the same result? Now, therefore, what did you get out of it? Nothing. So what? Is that point for Bernie? No. If they still can't afford healthcare under the ACA, which is the topic of the debate, then Bernie still has not won the debate. He has to explain why healthcare system with Obamacare is better than without. That's the bottom line. And if costs have gone up across the board for ACA plans and non-ACA plans, then don't talk to me about the public option and single payer. That's not the topic of the debate. And there was another guy, Bernie sourced the fact that every other industrialized nation has universal health care. What do you want, some dumb article from Salon to be sourced? No, he could have sourced the study. Ted Cruz sourced the study by the Urban Institute, which is not a conservative group. I've looked up. The Urban Institute, by the way, is very critical of charter schools. It's very critical about a number of topics. I can go on their website. Okay, the first article they have is criticizing President Trump's plan to get Mexico to pay for the wall. Can a city be great if only some residents are thriving? Those are progressive. That's like against gentrification. What could happen if the Violence Against Women Act is defunded? Okay. DeVos opposes regulation. What will that mean for higher ed? The new Education Secretary's positions on K-12 education provide clues about how she might with. So that's a little more analytical. Blocking funds to sanctuary cities could hurt all Americans. They're not a Trump sympathetic outlet, the Urban Institute. The fact that they tried to paint Cruz's points as being, cherry picked or whatever, it's not cherry picked. This was a credible think tank, maybe not one that I agree with, but it's a credible think tank, and you can't, just throw away think tanks you don't like. They did a study on his healthcare plan, and they trashed it, and rightfully so. He doesn't have a good healthcare plan. So what did this commenter say? He said, at the point, the same commenter that asked about Salon, why didn't he cite Salon? He could have cited a study. He could have cited a study by Brookings Institute or one of those other liberal douchebag think tanks. Okay, and it would have been fine. That's fine. It's academics. This is a debate. Okay. At this point, the debate is rhetorical. Small business does no worse than the other major nations relative to America. So while it's a valid concern regarding the execution of healthcare reform, it's been proven to not be as insurmountable as people like Ted say. It won't wreck small businesses in America just like it hasn't anywhere else. And while Bernie's debate wasn't perfect, Ted Cruz's entire premise doesn't make any sense. The insurance companies are ripping you off, so let's deregulate them. It doesn't matter how many statistics you twist into that argument. It's nonsense. And then he goes after, because I called them cult members because all they want to say is, oh, Bernie's so nice and whatever. They are literally incapable of criticizing their candidate. I've criticized Ted Cruz. I think Ted Cruz is kind of creepy. Okay, I've said it in other videos. It doesn't. And look, if you want to say my videos look creepy, that's fine too. But we're talking about a debate point. Okay. So what we're talking about here isn't whether you think Ted Cruz makes you feel better or whether Bernie Sanders makes you feel better. It's whether they address the topic of Obamacare better. And this guy didn't. So, and I'm probably going to reply to him about that too. And then there was another guy that, so I'm going to address this. It's every industrialized nation has universal health care. Well, so what? The United Kingdom has universal health care in the NHS, the National Health System. What has that resulted in? It's resulted in massive health tourism from Nigeria and other third world countries that costs the British taxpayer billions of pounds per year. And they're sick and tired of it. There's massive criticism of it. It's one of the reasons that their immigration position has become so much more hard to defend. The position of the current prime minister, who's conservative, Theresa May, is being undermined because she is trying to still keep some of this immigration open. She's still trying to allow some of these migrants to come in and immigration from other countries that are, and refugees, etc. And that's the main crux of the argument, okay? If you are a country that has single-payer or universal health care, look, it is possible if you have a lot of other economic factors going in your favor, liberalized markets for one, and deregulated sectors in industry. Let's say you have a massive auto industry or something like that. In some of these countries, you're talking about countries that were already industrialized when they put in universal health care. But what has universal health care gotten them? For a long time, these countries were doing very well because they had low immigration, or they had at least controlled immigration. The immigration issue and the health and the single payer universal health care issue they end up being on a collision course. And let me explain why, okay? If you take people in a given country and You provided them a resource that they pay for and that they fund and that they it's automatically deducted from their salary, and they voluntarily do it. It's almost as if it's a co-op on a national level, and they control their healthcare costs, and everybody gets it provided for free. Okay, so that has worked in places, and I actually was a payee into a system like that. It was the National Insurance System of Israel. It does have its benefits, but that assumes that everybody pays it. So therefore, once people stop paying it, and there are, let's say, a homeless person, they can't afford to pay it, so they automatically get, their property. They get what do they call it? They'll get liens on their properties and things like that. It's a very difficult situation, and it's not as if those charges are insane over there, but you do end up getting in trouble if you don't pay it. Obviously, otherwise the system can't work, and that's understandable. So it can work theoretically. However, what complicates the situation when you introduce people into the system that have no means to pay for it, that are incapable of paying for it, and that you can't hold them accountable for it, such as illegal immigrants or refugees, or simply people that they assume false identities or whatever. It could be for whatever reason. That puts enormous strain on the system. Why? Because if you hold it that these people cannot be removed from the country, if that is the case, okay, I'm not saying it's the case here, although it's very close to being the case in some states. It's almost literally impossible in some parts of the country to have these people deported if they're discovered to be here illegally. However, so you could have people like that, and they would come into the country and basically use the benefits of the system without actually contributing to it, because they're not capable of having a what was it called, a W-4. Well, they can't be e-verified. They can't be, their identity is basically often from a fake social security account in our case. In other countries, there's similar parallels. It's not as if what's happening in the United States is only happening in the United States. It's happening in the United Kingdom. It's happening in Israel. It's happening in countries like Sweden. It doesn't happen in Japan because they're strict enough to say, well, we're not going to let illegal immigration in here. The Japanese government, if we were to adopt the policies of Japan with regards to regulation and private and public health care, but keep their refugee policy, it's very likely that the United States would have a successful go at it. I mean, it's not, I wouldn't say that that's the only factor. I mean, remember, you have to have people paying consistently, and if they're able to hide their assets, if they're able to do things that are going to be able to cheat the system, it's possible for people, even in an industrialized society with single-payer healthcare, to hide their income and cheat the system. It's just a fact. And those of you that think that, oh well, we could just raid people, we could eliminate the big banks and things like that. That's the madness of the Bernie Sanders supporter corner. They all think, well, all we have to do is break up the big banks and use Ted Cruz was not the only person to debunk that. It's been proven time and time again that even, let's say you confiscated the assets of all those people. First of all, you couldn't do that because they would be able to, a lot of them have their assets ensconced in overseas accounts, in the Caymans, for example, in Bermuda, in Montserrat, in all these banana republics around the world, the Bahamas. And all they would have to do is they would flee to, you would have capital flight. It's happened in country after country after country. And those of you that think, oh, well, we're just going to prevent them from, we'll make them flight risks or whatever. What you will do is bring this economy to its knees. It's impossible. And we're straying away from the topic of Obamacare anyway. What the debate did was to outline how you have, on the one hand, the Republicans that are successfully defending their position on private health insurance. It's not an indefensible position because they've succeeded in defending it, as opposed to the Democrats that have not been going to bat in favor of Obamacare. They haven't. Look, and I'll put this up. Okay, I've already addressed the issue of the other industrialized nations. The other industrialized nations have, in many cases, universal health care. It's not always good. In the United Kingdom, it's pretty good, but it's under strain because of massive illegal immigration and refugees. And health tourism, which is a major problem, and it must be addressed over there. It's not as if they're all happy in England, if you haven't noticed. I mean, you do know that the Brexit happened. So why are you pretending that every industrial nation loves their health insurance system? Well, maybe they do, but they recognize issues that are tearing it apart and creating fiscal stresses to it. Okay, the final point I'm going to make, and with that I'm going to end, is Bernie Sanders. Why was he even on the debate stage? And I'm not saying that because I don't like Bernie Sanders. I don't like Bernie Sanders. But, it's fine for him to go on TV and debate issues that he's fine with. But why is it that the person selected by CNN or selected by whoever did decided that they would put the one progressive, and he continues to say that he's not a Democrat. I'll call him a Democrat, but let's say for the sake of argument that he's still independent, even though he votes usually with the Democrats or to the left of the Democrats. Why did they put him on the debate stage when he was the one person who was the most critical in the Senate on the Democratic side of the aisle to the ACA? Well, I'll have you know that many Democratic senators have already written off Obamacare, and they know that it's futile to tie their careers to this failed program. Cory Booker is not going to defend the ACA. You're not going to see Kirsten Gillibrand. You're not going to see Dianne Feinstein. You're not going to see, and first of all, they're not going to stake their own careers to it. Okay. So I'll rattle off the Democratic senators. You have Sherrod Brown. In Ohio, we've already voted overwhelmingly against Obamacare. Our governor rejected even the Medicaid. I think he did the Medicaid expansion. That was it. But he rejected putting together a alternative Obamacare exchange. That was one of the few good things that Governor Kasich did. Our useless Republican governor, who's pretty much a peach tree sitting in the garden doing nothing during the winter. What Governor Kasich did was he refused to make an Obamacare exchange, which was a good choice. Now, Sherrod Brown, our senator, is not going to go out there and take any hits for Obamacare. There's no reason to. He's going to have a hard enough time winning in what's now a red state in 2018. That's a different video. So Sherrod Brown, one of the more liberal Democratic senators, isn't going to go to bat for Obamacare. Elizabeth Warren, I'm kind of surprised. Maybe she would have gone to bat. That's a different reason. There's Sheldon Whitehouse from Rhode Island. There's a bunch of, what's his name, Richard Blumenthal from Connecticut. All of these blue state senators, why didn't they come out and defend Obamacare? I'll explain very quickly. It's because not only is it something that you can take hits for as far as the electorate. In some of these blue states, it doesn't matter. You could literally advocate for child pornography, and if you have the D next to your name, then you're fine because they'll vote for any Democrat. The Northeast, and Maryland and all these super blue states, they're the new solid South. They're the new yellow dog Democrats. They'll vote for any Democrat, doesn't matter how ridiculous their positions are, except in the governor races. But in the Senate, yeah, they'll definitely. I mean, in some cases, you've had slip-ups, like the woman who lost to Scott Brown in Massachusetts. But on the whole, it's very hard to lose in those states. Now, in the red states, those senators or Senate candidates are not going to go and take a position in favor of Obamacare. So why didn't they come out and debate it? You'll ask me. Well, the reason is that they really can't go out there and publicly on national TV actually make an argument for a system that ended up raising premiums and deductibles so high. And therefore, let me put it this way, the Democrats, instead of having somebody go out and defend their failed healthcare bill, Obamacare, the ACA, they allowed somebody to go on there and push the public option or not even the public option, universal health care. And they allowed him to go out there instead of in lieu of anybody else. And maybe it wasn't even the word allow. The word would be that they didn't, that maybe Sanders did it of his own accord. Maybe other people declined to do it. But at the end of the day, you have somebody who himself was a huge critic of private health insurance, which is what Obamacare is. It's private subsidized health insurance. He was a huge critic of that, and he was saying that it wouldn't work. And they send him out there to defend it. It doesn't work that way. And those that are saying continually that Bernie Sanders outperformed Ted Cruz, it didn't happen. Okay, I hate to burst your bubble, but just because you like Bernie Sanders doesn't mean he won the debate. He wasn't very good at the debates with Hillary Clinton. And in fact, there's a blog here I see where he points out that there were points that he could have scored for his side that he failed to do it. Here it is. Unfortunately, Sanders didn't quite drive home the key point that the Republican plans only protect people with pre-existing conditions if they maintain continuity of service, of coverage. More than once, Sanders brought up the fact that the U.S. spends more on healthcare than any other advanced country, even though they have universal coverage and we don't. Each time, Cruz blamed this on rationing. For example, Cruz says Sanders often points to Canada, the United Kingdom. He says, why do we pay more? Well, there's a reason we pay more than those countries. We get a lot more and a lot better health care. Let me give you some basic facts. As I noticed in all the Democratic primary debates, there was no discussion of the facts on the other side. The United States population control delivers 3 times as many mammograms as Europe, 2.5 times the number of MRI scans, and 31% more C-sections. We provide more health care. Not only that, in the United Kingdom, for example, wait times in 2013, you waited 72 days for cataract surgery, you waited 89 days for hip replacement, 95 days for knee replacement. There are 3.7 million people in the United Kingdom right now on a waiting list waiting for health care. Whenever you put government in charge of health care, what it means is they ration. So then Sanders replies that the health insurance companies ration as well. But this blogger, his name is Dolan, Ted Dolan. He says, true enough, but if Sanders had really been on his toes, he would have challenged Cruz's assertion that waits for care are longer in other countries. Cruz had a notebook full of useful data. Sanders should have had one too. All he had to do was use the same tactics that Cruz did. Among other things, his notebook should have included data from a widely cited study of healthcare in 11 wealthy countries from the Commonwealth Fund. Key findings of the study: far from offering a lot more and a lot better healthcare than other advanced countries, the U.S. ranked 11th out of 11 overall, 5th on quality of care, 9th on access, and 11th on efficiency. On timelines, the U.S. ranked 5th overall. Okay, so he could have made use of some. Okay, what I'm saying is Bernie just fucked up. Here, he even has a section that says Bernie's biggest fumble. And he talks about the small business lady. And here's Sanders' answer after this small business lady said that she can't afford her own health care. He said, let me give you an answer you will not be happy with. If you have more than 50 people, you know what I think. I'm afraid to tell you. I think you will have to provide health insurance. If you have more than 50 people, yes, you should be providing health insurance. So the blogger, Ted Dolan, replies, I don't know what he was thinking. Sanders' own health care plan, Medicare for All, completely eliminates employer-provided care. His answer to Hunter's question should have been simply that employer-provided health care is not a good idea for any business, large or small. Later, Sanders seemed to remember that and try to get back to try to backtrack, but it was too late. I give him a D for the. Okay, so then, never mind. So even people that are further on the Sanders side of the debate, if they actually analyze the key points, they realize that whatever your view on healthcare, he made an awful job, A, of defending the ACA, and B, of refuting Cruz's arguments attacking the ACA. So I'm going to stop here. It's Ramon from Bold Like a Leopard, and we're going to discuss this more. The healthcare debate is going to keep going on. I think Senator Sanders is going to have to really up his game or something about that, because he's really going to be the only person on the Democratic side of the aisle with any balls to address the issue. But if he doesn't have brains to back his balls, then what is he really representing? So again, this is, sorry, I was about to sign off, but this is Ramon. This is Bold Like a Leopard. And there's going to be more videos probably tonight. And we'll see you around the bend.